You're good.
Okay. Call the meeting to order. And could I have a roll call? Ms. Hackenberg,
Dr. Moore,
present.
Ms. McGregor. Here. Dr. Morrison.
Here.
Ms. DeWitt.
Here.
Mr. Adamson.
Here.
Mr. Griffith.
Here.
Ms. Johnson.
Okay, I think we have a forum established. Is there any additional adoptions to the agenda? All right, hearing none, I have a motion and a second to adopt the agenda as presented.
So moved.
Second.
Okay, so voice vote, all in favor, say aye.
Aye.
All opposed, same sign. Okay, motion carries. Okay, we're looking for approval of the last meeting minutes from July 23rd. After you have reviewed those, are there any additions or modifications? Could I have a motion and a second to approve?
So move. Second.
All in favor, say aye.
Aye.
All opposed, same sign. Okay, motion carries. Public comments. Do we have any public comments?
No.
No? Okay. I'm just glad y'all joined us then. Any old business? Okay. New business, we have Miss Megan. Sewage variance.
Good evening. We have a sewage variance request for 953 Sylvan Shores Drive. The owner is requesting a post installation variance for a pool that has already been installed, but however, it has been installed over top of their current leach field. So the pool is built up, so they did not necessarily dig into their leach bed, but the pool is sitting on top of their current leach field. The plans also include a large amount of hardscape around the pool. And there is no room on this property for a replacement area due to the lake being at the back of their property, because there are certain isolation distances that have to be met from that lake setback. So we have reviewed this request, but we would recommend that we do not approve the variance due to these reasons. Be happy to answer any other questions on it.
Megan, do you want to explain what the septic should be from any part of the pool?
Yes, so we need to be at least 10 feet away from any part of the septic system, so the septic tank and any part of the leach field, and then the replacement area, if there's a replacement area on the property. But they're actually right on top of the leach field, which you can see in some of the pictures that are attached here.
How does this work in the permit? In the permitting of things like this? Wouldn't that be something the contractor would have been aware of? The
Should have been,
homeowners?
yes. So my understanding is they did get permits through building, but they did not come through us prior to construction beginning.
And they're supposed to.
And they're supposed to, but
So what are the options?
Did I hear that right?
at this point, disapprove the variance request, and then they have a disapproved portion of their septic system, which would need to be disclosed if there was any other future sales or anything of the property.
Okay.
But really, this will just lead to premature failure of the septic system due to, honestly, just the weight of the pool and the water.
Mhm.
Unfortunately, it's already begun.
And the homeowners understand that that's what's coming for them? Oh, that's gonna be fun.
Yeah.
Okay.
Yeah, so to go a little further, I mean, we are not going to go out and cordon off their pool and say you can't use it. We're going to not make them move it. It's just, we can't approve this. I mean, because it is nowhere near even something that we would recommend for approval. So it's just no. And then one day it may be a problem if they go to sell their property, depending on who buys it, the loan they get, that kind of thing, because they will not have an approved sewage system. And it's unfortunate all the way around, but I think our options are pretty limited, and our recommendation is to disapprove it.
Question,
Yeah.
did I hear you say that they did get a permit to start this construction, but it didn't go through us?
Correct.
So
They got a
they
permit
did
from building,
through building.
but it was not.
I mean, from my, what I had information here, I thought that maybe this construction was undertaken without a permit, but they did get a permit. to do this. So it doesn't change the outcome any, but I mean, in terms of if they believe they did the right thing, there's still damage here. Their leach bed isn't damaged yet, right? But it's, is the pool up and running now?
Last time we were out there, it was,
Yes.
yes, there was not water in it yet, but it's pretty close.
They did one of the right steps. You know, that's just like one permit. I mean, there's lots of permits you have to get. I mean, when you put in a pool, I mean, electrical, you know, if they get underground, all of that stuff, we're one of those pieces. And I will tell you, I mean, building is usually pretty good about saying, hey, make sure you do this, this, and this too. But, and they may have told them, and they may have just said,
But they may have done all the things they needed them to do for the building permit, but they can't necessarily hold their permit because of our.
Can't believe an inspector didn't catch it before. So this is in Harmony Township?
Yes.
So what does the township have to say?
So I did send it to the township trustees and they were in agreement to deny the variance request.
Good.
Or at least one of the trustees did respond.
That's good that they're, okay.
And I understand you said there's not another place to put another
There's not.
sewage
Definitely not
system
now.
that should something. Okay. Okay,
it's part of the problem too.
Yes.
And what do you do?
So,
so,
So that'll probably go to the discharge system. and-
so they'd have to go with the discharge system. Is there room for a discharge system?
Yes, but where we would outlet, yeah, we'd have to figure that out when the day
There's
comes.
no closed ditch or,
I don't believe there's any storm drain out there.
okay.
and then with the lake right there.
Yeah.
Don't want to go there.
Beautiful.
Okay. That is beautiful.
Yeah.
All right.
They
So-
don't, yeah, London.
We have, I'm asking for a motion and second approving a sewage variance at 953 Sylvan Shore Drive, South Vienna, Ohio, allowing a portion of the sewage treatment system to be present less than 10 feet away from a swimming pool, with the responsible party signing a hold harmless agreement. Any additional questions?
So just point of clarification for the board, we don't do these often where it sounds like you're intending to disapprove. We had one of these with the goats and the sewage. Do you remember the goats and the sewage?
Yep.
Yeah, we had one of those. So same discussion is Robert's Rules of Order, so you put positive resolutions forward. So someone still has to make a motion to approve, second it, and if your intent is to vote it down, you vote no. It's to not say, I make a motion to deny and I say yes to the no. That gets confusing, but Robert's rules say positive resolution forward, then you vote down.
So moved. Second.
Okay, Ms. Hackathorn, could I have the roll call?
Dr. Moore,
No.
Mr. Adamson,
No.
Ms. McGregor,
No.
Dr. Morrison,
No.
Mr. Griffith,
Nope.
Ms. DeWitt.
No.
Okay, we have announced that the motion failed. And okay, Ms. Megan, you have a public health nuisance at St. Clair's Pike.
Yes. All right. So I have to give you guys a little bit of background. Actually, kind of a lot of background for this public health nuisance at 3745 St. Paris Pike. So the Clark County Combined Health District, Clark County Health Department has been working on this public health nuisance. I know I just rolled off the tongue, so has been working on this public health nuisance since actually 2023. So we began receiving complaints about a new owner living there and people living in tents and dumping sewage in the back portion of the property. Back in 2023, we really didn't have a whole lot of luck getting onto the property to observe this. And then we received another complaint in 2024 regarding a similar situation about a makeshift septic system now being installed on the property and different evidence and things like that. In this time frame, the health department was advised by law enforcement to not go to this property alone. So that kind of added a little bit of extra to it as well. So after another attempt to gain access to the property back in 2024. We then received a phone call from the German Township Police Department that on August 29th, 2024, the property actually had a fire. The shed had burnt, and there was then an arson investigation. So we were then asked to come out to the property. So on September 3rd, 2024, the Health Department and the German Township parties were on the property to observe two, I'm going to call them bulk water containers that were actually in fact buried into the ground. And they were collecting sewage at that point. And there was also, we observed a large hole that we were maybe guessing was where they were maybe trying to hand dig a well. We're not really sure what that was. There's several sheets of pictures in your packets tonight. So back then we started mailing the owner letters about an illegal septic system being installed on the property. That was in September of 24. We went back out to the property late September of 2024. Once again, unable to access the property to observe those tanks being removed as we required. Moving forward a little bit in October, actually on October 22nd, 2024, the Clark County Health Department obtained an administrative search warrant to go onto the property, surrounding fields, accessory structures, dwellings, campers, everything. While executing that search warrant, we observed those tanks were in fact buried in the ground, and they were actually still actively smoking while we were there. So they tried to set them on fire to get rid of them. So we then had to call out German Township Fire Department during that time. So we once again mailed letters about the illegal septic system and also started mailing letters about the dangerous and unsanitary conditions due to the lack of running water on the property. Through the rest of 2024 and 2025, we monitored the property, reposting placards several times stating that the property must remain vacant because of the lack of sanitary facilities. In August of 2025, drone photos of the property were obtained while we were seeking legal guidance from the prosecutor's office. In May of 2026, we received more information regarding the property and the possibility of dirty needles being found near the property and the surrounding areas. So the health department reached out to German Township Police Department, and they provided us an escort to the property to reevaluate the situation in June of this year. On June 16th, 2026, we were able to speak with a gentleman who was at the property at the time, leaf blowing. He admitted that they did not have running water and stated that the porta potty on the property was their means of using the restroom. So I explained to him that no one can be living on the property without running water, and that has been deemed unnecessary, dangerous and unsanitary facilities. So then we reposted the placard again. I've reposted a lot of placards over the time. So then we were seeking more legal guidance from the prosecutor still. And then on the 14th of July of this year, the health department and then German Township zoning, Clark County prosecutor, and also Clark County community development, we all met regarding our findings and our concerns about this property and what our next steps were. Through this meeting, we were able to ask the judge to sign off on another administrative warrant to allow us access to the property to get up-to-date information to present to you guys. And on July 27th of 2026, we were able to get the signed administrative warrant and executed on the same day. And the pictures in your packet are dated, but a lot of those pictures are from our most recent search warrant on the 27th. Also, we have since received copies of notices of violation from community development regarding the development in a floodplain, and also notice of order that we sent to the property owner for the accessory building on the property being used as a living unit without approval. And also in front of you, I believe you guys have hard copies of the 30-day notice from the German Township zoning stating that the Board of Trustees had declared the property a nuisance on the 11th of August. And then tonight, we're asking you to declare the property a public health nuisance due to the lack of sanitary facilities, running potable water, and the lack of plumbing facilities. Sorry.
Thank you for that very thorough report. I appreciate it. Okay. I have before you, I'm asking for a motion and a second to declare a public nuisance at 3745 St. Paris Pike, Springfield, Ohio.
So moved.
Second.
Is there any additional questions or comments? Ms. Hackathorn, roll call please.
Dr. Moore,
Yes.
Mr. Adamson,
Yes.
Dr. Morrison,
Yes.
Ms. McGregor,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith.
Yes.
Okay, Springfield Animal Hospital contract. Ms. Megan.
Okay, sorry, me again. Okay, so we are asking you tonight, the current contract we're asking you to approve is for, Springfield Animal Hospital. We do have a standing contract with, Northside Vet here in Clark County, but this is more of an as-needed basis for this contract, with Springfield Animal Hospital. We had a couple instances here lately where, basically the capacities couldn't be met for our services, because we kind of need services when we need them. So we're asking you guys to approve the contract for Springfield Animal Hospital tonight.
Okay, so, I was just reading through the contract. It's interesting. All right, so I'm asking for a motion and a second to approve the contract with the Springfield Animal Hospital.
So moved.
Second.
All right, are there any questions after you guys have read the contract? I have some.
So
You have questions? This isn't like bedtime reading for your kids, right? This is,
I'll let you go first.
So one of the questions I have, so the quarantine service at $22 a day, is that for all animals, domestic and?
I don't know that we've ever used that. So that is, I mean, 999 times out of 1,000, they're quarantined animals at home. We do the observation after 10 days.
Okay.
If there was some situation where it was like maybe I don't know, maybe the owners died. I don't know. I'm trying to think of something that would be
This,
very,
yeah.
and we needed the quarantine, the vet would quarantine for us.
And also we would probably try and have the dog warden quarantine before we would even ask the vet to quarantine
This
as
is,
well.
I don't know if it's ever been used.
Yeah.
Okay, I was just curious. I mean,
But in case we ever need it.
So after they've been euthanized, why do we have to remove their heads?
So the rabies testing is testing the brain matter. So we just have to ship the heads to the rabies lab.
But just suck it out through their ears, huh? Okay. All right.
That's just in the movies, Valerie.
That's just in the movies? That's just in the movies?
The same one she is, apparently. Who came up with the idea?
Okay. All right, well, thank you. I appreciate that bit of education for this evening.
And I will say Springfield Animal Hospital was very willing when we needed them, so I'm grateful to them.
Okay.
So yes, having them kind of as a backup is what we're looking for.
Okay.
We hadn't needed one, so we learned.
All right, well, thank you very much.
Valerie, can I also just say, before we took animals to vets, registered environmental health specialists did it themselves. When I was a young pup of a sanitarian, I did it.
Oh.
Yeah.
Well, I guess this is
I don't
much
want to
kinder.
I think it would be really nice.
I don't think I would.
Love
Let's not revisit the old
Yeah.
days.
No, that's not. We're not agree.
That's some more education. I thought you just pulled it ahead, okay.
I think they called that easy.
All right, any other discussion? Please.
Dr. Morrison. Dr. Moore,
Yes.
Mr. Adamson,
yes.
Ms. McGregor,
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt.
Yes.
Okay, artificial intelligence, Ms. Gracie.
Yes, so, you have a policy in your packet, a draft policy of, to put some guardrails around artificial intelligence, that's used for health department work. We are under no illusion that people aren't using it to help aid in their jobs and, do administrative things. But before this, there's really been no, it's kind of been willy-nilly about it. So what this policy and procedure does is puts some parameters around what would be acceptable to use, specifically anything that is purchased and licensed, and managed by the health department. That goes into play for like record retention issues and things like that. There's a lot a lot of still question marks around record retention and artificial intelligence and all of that stuff. So this is just helping that. So like any free accounts of open source things would not be allowed to be used for health department work. Another thing that this does is reiterates that it is staff responsibility for anything that AI produces. It must be reviewed, drafted, approved before it is published to the public or used in any official manner. And then also it talks about no HIPAA information, protected health information can go into any AI system, whether it is we own it, like, or licensed it or anything like that. So just put some things around there for staff, and then also talks about disclosure of using AI. So if it's like the main work was done by AI, someone reviewed it and was like, yeah, that's pretty good, I'd like to put that out, then we just have a little statement that an approved AI assistant was used with this work product. Our staff carefully reviewed the final product, just so that there's some transparency there, but also that people can be assured that anything that we produce, we also review, because that human review is very important.
Gracie, this is probably addressed in here and it's just buried. And another board I sit on, we had to create a policy around the use of agentic AI for people who call into meetings or have any sort of Zoom meetings. A lot of people have transcription AI that then automatically sends that meeting out to a large participant list.
Everybody on the mailing list.
And that may or may not be correct, and it may or may not be the actual people involved in that conversation. So this is a hospital system we're talking about, so it's super confidential, but just, I know we don't use that, but we might in the future for whatever reason.
Yes.
Post 2020, nobody would have ever thought we used it as much as we did, but
Yeah,
just be careful with what's being discussed.
Yes.
That's not being listened to.
Yeah, and I always, I don't know about you, but when I run meetings, I kick those out. So, I don't know. So this is a draft, and we know that this is just a starting point for us. Like, as things develop and things evolve, we will probably have to evolve this policy as well, as we encounter things like that. So it was just a starting point because we had nothing. And it was just kind of free for all.
It will definitely be a policy that will be reviewed frequently. Okay.
There's, as you'll see here, there's only 2 products that we're allowing. It's Microsoft Copilot because Microsoft has the right type of security to allow us to use it. We purchased that product. We have 365. And the second one is Canva AI, and we have a paid account through that. So it's not, ChatGPT, things like that, it's out of bounds. We're not using that. So it's pretty limited.
I have a question. So Gracie, for board members in particular, we receive a board packet. And so if I am doing research today, in fact, for the issues that are on the table, if I'm using my own paid AI account to do my own research, would this policy impact my ability to do that? Because I don't have access to the tools that you referenced there, Chris.
No, I don't think so. I mean, so first of all, I don't know that you would be considered a paid employee of the health department, though you might receive, for attendance. That's a contractual relationship. I think this policy is getting towards the production of things and not necessarily research. So summarizing, every time I open up Adobe Acrobat now, it says, do you want me to summarize this stuff? No, I can read.
I prefer to read.
And so, yes, things like that, tools like that, I don't think so. It's a good question, but I think we would probably agree that doesn't apply.
Because it's not being, I would agree that it's nothing that's going to be produced on behalf of the health department. It's your individual tool that you're using to aid in your,
I would say the wording may need to be tweaked though, then, because it does actually specify board members in the policy, and then it specifies research in the policy. So we may have to.
Since it's a draft, that's a good clarifying statement.
And the other thing I'm thinking too,
I know it's an approved AI assistant. But I'm just hoping people understand, if you use that as a disclaimer, when you send something out or
Yeah.
whatever, they probably would know.
Yeah. And we'll give examples of things that like wouldn't be allowed, like ChatGPT and stuff
Right.
like that, so.
Right. I know that's in there, but I guess I was thinking maybe you put in parentheses, the two that you use.
Yes.
Because
Yeah.
everybody else, like me, I would have probably thought, oh, they probably went on chat,
Yeah.
GPT and
Yeah.
got their info.
Yeah.
Just a thought.
Oh, for this disclosure.
Yes.
Yeah,
For the
okay,
disclosure.
got it, yes.
Because
it's
an approved.
Yes.
I think it's important to say which ones too, because you can put the same prompt in to multiple and you're gonna get a little bit different response. The other thing that happens is paid versions usually tend to do a deeper analysis than free versions of AI. So I think it is kind of nice to know.
What was used
Mhm.
or allowed or whatever. I don't know.
All right, let's see here. Could I have a motion and a second to approve the AI policy, knowing that it's going to be
So
modified?
Second.
All right, any additional discussion or questions?
Yes, I would just want to make sure that I understand that the goal is to protect the confidential information and staff work, but not necessarily to restrict board member research.
Correct.
And I think that the sentences that we talked about might actually do that. They could be interpreted as restricting board members from being able to do independent research.
Well, if you'd like to, if you feel more comfortable, we could table it till next month and we can rework it so that it addresses both of those things. And then we can bring it back at the next meeting.
Is there an urgency to do this now?
I would say I have mild urgency because, like Gracie said, things have been happening and I would like to put some guardrails around it. The other complexity is we've already had a motion in a second, so you actually have to vote it down at this point, which is fine. Or you could say as part of, you can amend your motion to say with these
With
changes.
these changes.
If you want those
That's what I was
specific.
going to
Let's
ask
do that.
you.
Can we
Yeah,
amend that?
okay.
sentence?
Yes,
Can we amend it?
absolutely.
Okay. All right, so we have a motion and a second, and we're gonna ask for an amendment to the statements about board
To the
members'
motion.
use.
And
To the
research.
motion, yes,
To the
and the research and the disclosure.
God love the person taking.
Yes.
Shannon.
Shannon is.
All right. Are we there yet?
I'm good. I got it.
Are we good?
Uh-huh.
All right. Now Shannon.
You got it.
Yes.
Mr. Adamson,
Yes.
Ms. McGregor.
Yes.
Dr. Morrison,
Yes.
Mr. Griffith,
Yes.
Dr. Moore.
Yes.
See, AI would have been helpful there.
I jokingly said, Gracie, just have AI write its own policy.
Write the new policy on itself.
All right. Rural Health Transformation Grant Submission. Ms. Gracie.
Yes, so you have one of the grant summaries in your packet. Part of the federal budget bill last year was, if you remember, it was, they put some funding in for rural health transformation or rural health initiatives. So Ohio, as a state, the Ohio Department of Health applied for rural health money and they were awarded. So they have a program now called Rural Health Transformation Programs. They've released a lot of solicitations for funding, but a lot of them up until this point have been for more suited for larger hospital systems, things like that. But this one is specifically for local communities. So it's called the Healthier Ohio Community Level Chronic Disease Prevention and Management Program, or RO27 for short. So what this does is it really focuses on chronic disease prevention and management, specifically diabetes, hypertension, heart disease, that kind of stuff. So we're gonna ask for approximately $100,000. We haven't done the whole budget, but That's the minimum ask that we can make, so we're gonna make that. And then really what it's going to do is going to allow us to hire what they call a rural health coordinator. This grant will be under health planning, so it'll be one of our health planning programs like our tobacco cessation or creating health communities, and it will build upon the work that's already being done within our chronic disease task force that came out of the community health improvement plan many moons ago. So they work in diabetes and hypertension and some cancer screening right now. And what this will do strategies to kind of give those a little bit more capacity and foundation. We'll be able to put, a dedicated person. Right now, it's just volunteers from the Rocking Horse and Mercy and the health department that's doing the chronic disease task force on top of everything else that they do in a day. So this will be a dedicated person to help move those initiatives forward. So one of the main things is doing a referral system from healthcare providers to community programs, so like community gardens or a fitness class at the Y or something like that. So really kind of thinking outside the box with these initiatives. But that's the grant in a nutshell. I'm happy to answer any questions, and it's due this September 8th. Quick
Okay,
turnaround.
to ask for a motion and second to authorize the health commissioner to do all things necessary, including submitting the grant application.
So moved.
Second,
And I'll just mention, so this is a competitive grant, but it's a 3-year grant cycle plus the option for 2 more, so potentially up to 5.
very nice.
So I do have a question when we're talking about rural health, because we do know that in our rural setting, we do not have enough healthcare providers. Did I say that out loud? Okay.
It's in the minutes, and it's in the minutes.
Yes. And so would this allow us to have like a health practitioner that can assist with
Unfortunately not.
screenings or something?
I mean, we could figure out creative ways to maybe partner and like gain capacity that way, but the funding's not there to like hire someone or be able to pay them to do that. But
Okay.
yeah, the goal,
No, please.
No.
There's 5 sectors that we have to work in. It's delineated and we have to pick certain things and how many are prescribed to us? 2 of the 5
2
are
of the
prescribed to
5.
us. Their population level, their policy level, they do touch a little bit on direct service, but it's not hiring an NP to do that work in rural health. The previous rural health transformation grants, the hospitals have been able to apply for, were for that.
Okay.
Well, I just want to say, I think it's much needed, a coordinator. Even to coordinate diabetes education, there's a big gap
yeah.
in education. So it'll be good.
All right, any additional questions?
So this isn't a full year, but the subsequent ones would be a full year.
Correct. I believe what they're doing, they've done this with a couple of other grants that we've had through the health planning section, is they have a fast turnaround, but then they're trying to get it on the state fiscal year. So then, the subsequent years will be the full July to June.
Okay, any additional questions? Ms. Hackathorn.
Ms. DeWitt,
Yes.
Mr. Adamson,
Yes.
Dr. Morrison,
Yes.
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Ms. McGregor.
Yes.
Okay. Moving to the American Academy of Pediatric Vaccine Schedule Adoption and Position Statement. Mr. Cook.
If you remember back in January, RFK Junior HHS modified the CDC's vaccination schedule for adolescents and children. And we had a discussion at a board meeting. I know a couple of you weren't on the board at the time. We had a discussion about our alignment with the AAP. Had good conversation with Dr. Thompson as well as our medical director. And we agreed that we were going to recommend and follow the AAP as pretty much every healthcare provider in the nation was going to do anyways. But with recent events and recent executive orders that were at this point have been fairly meaningless, I feel like we need to take a little stronger stance and not just have a discussion and let you all know this is what we're practicing in our clinic rooms over here. So what you have, and you have hard copies of this, is a position statement. And a lot of this reflects the discussion we had back in January. And I just really want to kind of memorialize it and say, Clark County Health Department believes this, and this is our position on this. There are 5 very small paragraphs here. I'm not going to read the whole thing. I bolded a few things here. The first one basically says that the Ohio Revised Code is what outlines the vaccinations that are required for school attendance. There are 10 of them. Any changes at the state or at the federal level do not affect the state. We have home rule that was unaffected back in January, unaffected by the executive order. That's all still very solid. The second one is about those changes not affecting us and don't align with our Ohio law, so we trump that. No pun intended there. The third paragraph is recent changes that we've had, including the EOs, don't align with science. They're not evidence-based, and there was no new information that was presented when that EO was written. It's a nice way of saying nice ideological change. It's not based on anything, especially science. The fourth paragraph talks a little bit about how we've aligned with the AAP, American Academy of Pediatrics Child and Adolescent Immunization Schedule. It's backed by decades of evidence-based peer-reviewed science. It's our recommendation. It's what we're going to use for both types, frequency, and timing of vaccines administered to the kids here in Clark County, and that's what we're encouraging families to go by as well, which is what is in that last paragraph and gets a little deeper into that school attendance. We have also encouraged schools to go ahead and adopt policies. The Revised Code allows them to adopt their own policies. Very few schools do. They just look to the local health department for guidance, and that's what this is. They already had guidance based on our conversation back in January, but again, this just kind of formalizes it and speaks with a little bit of a louder voice, I feel like, for us to take this stance. So happy to entertain any questions that you might have.
Okay, I'd like to have a motion and a second to approving the position statement.
So moved.
Second.
Any discussion or questions? Ms. Hackathon, roll call.
Mr. Adamson,
Yes.
Ms. McGregor,
Yes.
Dr. Morrison,
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt,
Yes.
Ms. Johnson,
Yes.
Dr. Moore.
Yes. Okay, personnel policy update, Mr. Cook.
2 policy updates. Go to the second one. Well, actually 5.1. I guess that is listed as 5.1 and 5.2, but it's the second page on your iPad. This is just a little bit of a cleanup of when we went to our new insurance provider. Full-time for the benefit eligibility is defined as 40 hours a week. So we had to adjust our language a little bit here. It didn't impact anybody. The people that have insurance from us are 40-hour-a-week people. We don't have anybody getting insurance that's under that, but it's just to clean that language up a little bit. And while we were at it, we decided to roll the dental insurance that was, for whatever reason, separated into the entire Section A, which is health, dental, and life insurance. 5.2, which is the first page of the red line changes there, has to do with sick leave. And so this is to give our folks another tool to kind of take a look at potential abuse or misuse of sick leave. What this does is it delineates in here that employees who have used 2/3 or more of their total annual sick leave accrual, if they've used 2/3 of it, anything after that they want to use, they have to have a physician statement, a doctor's note, so to speak, right? We already had some language in our policy that if you're gone for 3 days or more, you have to have a doctor's note. But if you're using more than 2/3 of it in a year, we've decided, you know what, to help alleviate any suspicion of abuse or misuse of sick leave, you just have to have a documentation from a licensed medical provider. A caveat to this is in that calculation of 2/3, we don't count FMLA leave in there. So that's subtracted out of that. Also subtracted out of that is any other leave you've taken that has a medical documentation. You have a knee replacement and you're gone for a week or two, that doesn't count towards that 2/3 of your annual accrual. So we're just really looking for a tool for our directors and our supervisors to be able to use and say, hey, you know what, after 2/3 of your leave, if it's a earn it and use it type of thing that we see sometimes, this gives us a tool to say, hey, you're gonna do that again, you gotta have medical documentation. You haven't entertained any questions. We talked about this core team for several months. This went through several iterations before it ended up here.
I had a concern about, but you just addressed it, so that's good, about like if you had a long-term absence and then that took up all your sick leave and not, I just wanna like have a headache, you know, and stay home or whatever, then I have to, you can't provide the doctor's note for that, but.
Could I have a motion and a second to approve the updates to the personnel policy as presented?
So moved.
Second.
Any questions or discussion? Ms. Hackathorn, roll call.
Mr. Griffith,
Yes.
Mr. Adamson,
Yes.
Ms. McGregor,
Yes.
Dr. Morrison,
Yes.
Ms. Johnson,
Yes.
Ms. DeWitt,
Yes.
Dr. Moore.
Yes. Staffing changes.
Thank you. We just had, we have one new hire and one resignation, which I believe Cheyenne and Megan will share in their reports.
Okay, we don't have any appointments.
We have
We have
one
new hire. Okay. So can I have a motion and a second for appointment of the new hire, new employees to the public health services?
So moved.
Second.
Any questions? Roll call, please.
Dr. Morrison,
Yes.
Ms. Johnson,
Yes.
Mr. Adamson,
Yes.
Dr. Moore,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith,
Yes.
Ms. McGregor.
Yes.
Okay, motion carries. Financial report.
To me,
Okay.
you've got the reports in your packet on your iPad, color-coded. Jeff usually highlights a few things. If you look in the expenses for this last month, for July, you've got a few things highlighted in blue. Be happy to, he just does that if they're like big dollar items, just to kind of draw your attention to it, typically around 10,000 or more. He highlights that in blue for all of you to take a look at. Be happy to answer any questions about any of those. When it comes to the other financial reports, I guess I'll wait and talk about that after you approve the expenses and vouchers. See, I'm ready to just go. I'm not being Jeff. All right.
Okay.
Questions about the expenses and vouchers? We'll stop there.
All right.
Question.
Mhm.
The 16,000 on the septic system, Trotwood H&S.
That was a repair. You want to talk about
That's paid out of the WPCLF, such as reimbursement to the installer through our grant program.
that? Water pollution control loan.
Yes.
Thank you.
Could I have a motion and second to approve the expenses and vouchers for July 2026?
So moved. Second.
Any additional questions?
I just have a question. On the bilingual outreach services, both for outreach and education, have we seen a decline in that?
We have less bilingual community health workers, translators, interpreters than we've had in the past. This is the lowest number we have. 3?
Yes.
We have 3.
So is the need declining as well?
I think we're aligned with the need right now.
Any additional questions? Ms. Hackathorn, roll call, please.
Mr. Adamson,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith,
Yes.
Dr. Moore,
Yes.
Ms. McGregor,
Yes.
Ms. Johnson,
Yes.
Dr. Morrison.
Yes.
Okay, transfers and advances, Mr. Buck?
There are no unbudgeted transfers or advances, and I would be happy to go to the next item, the monthly budget report.
Monthly budget.
Just a couple of comments. It's always good when you look down the last column of all these pages. Typically, it's the ending cash balance, and they're all black, they're not red. So we're in the black, so to speak, with all of these. Jeff's reports are evolving every single month and getting better and better and giving us more insight. You can see ending cash balance for the end of July was just a hair over $5 million. One thing that I noted is typically in either July or August, we get our second levy settlement of the year. It's usually, the settlement comes in, it's usually the beginning part of July. It's delayed this year because the final collection date for your taxes, for your property taxes was delayed as well. And so we were anticipate getting that second settlement by the end of this month. You know, you have to look, okay, how nervous does this make us with cash flow? Cash flow is solid. We have kind of kept our pace with our transfers and advances. So settlements, the levy dollars come into the general fund, and then we put it in the funds that need it, that are dependent on that. And so we try to pace that. We watch the funds. We can't empty out the general fund, the other funds like day one, January 1st. We have to kind of pace that. And so when you get about mid-year, when you need to make some more insertions, you watch it. We're doing okay. I don't think anything's going to break, so to speak, not having that settlement come in the beginning of July like it normally does. So feel pretty good about where we are, just watching a couple of funds carefully for income and expenses. But otherwise, I feel really good about where we are with the budget here at the just over mid-year point.
And we are moving on to public health team reports. Ms. Megan.
All right, so this evening, I want to introduce Sonia. So Sonia Bustos is with us tonight. So she has recently completed her probation, and she is one of our clerks here in the EH division. She started with us back in February. She's been a great asset to our team. She's been a great team player, and she's always willing to help out in whatever capacity we ask of her. So I just wanted to introduce you guys to Sonia tonight.
Hi, thank you. Okay.
Thank you. And then we also had one of our new hires, Mackenzie, start with us this week, so she's been doing great. Mackenzie will most likely focus more in sewage and the private water wells program, so she's got a lot to learn, but she's doing great so far. And then lastly, today and tomorrow, we're actually being surveyed from ODH and the private water systems program, so far so good, but we have one more day of that, so
Okay.
I'll bring you back more information next month.
And that's Mackenzie.
Yes, Mackenzie is our newest hire.
All right.
And Megan, how many surveys is that this year we have from the state?
3.
It's a lot.
It is 3.
It's
Yeah.
only,
It's a lot on
it's
staff.
only August.
It's a little
I
immobilizing
know.
for a couple of days when they come in and survey.
Oh, technically, it won't be pesticide too.
Oh, yeah.
Just threw that one in.
During the other one.
Nursing and clinics.
Yeah, so there's a couple things to talk about, but we'll do staffing first. So the resignation of her name was Ema. She was one of our nurses. She only worked 1 day a week. She was incredibly sweet. She was Haitian Creole speaking as well, so she was bilingual, which was super helpful, but she put in her resignation, and her last day was yesterday. And then we do have a new employee. Her name is Gilda. She's been with us for how long? July 20th, so a month now. And she is primarily in our immunization clinic. And so she's still training, all that good stuff. We do still have one opening for a public health nurse. That's been open, I just noticed it since May. That's been open for a good little bit. So if you know any nurses, feel free to send them our way. With Ema's position where she only worked 1 day a week, we weren't going to fill that. So that one's just not going to. And then we do have 2 of my staff members here. I'm gonna be mean. I was gonna make them introduce themselves. But one is Miss Tara, who I'll have her introduce herself, but she has stepped into the immunization supervisor role. And then Miss Jasmine is our newest sexual health and wellness nurse, who's actually stepped into Tara's role when she stepped up. So feel free, ladies. Tara, you have to introduce yourself.
Okay.
I'm Sarah. I started out in the sexual health clinic I started in October of 2020. So I worked through COVID and all the vaccine clinics, and then as Sandy retired, I applied for a job. So I'm settling into that. But so far, so good.
Yay.
And congratulations.
Congratulations.
Big shoes to fill.
I promised her she wouldn't have to talk.
Well, I didn't know.
Overruled.
Jasmine is incredibly shy, but she's very sweet and she is doing great. She is over there with the craziness that is the Sexual Health and Wellness Clinic, which just is its own beast. And so she is doing very good over there. And then the last thing to talk about is measles. So I just checked on ODH and they released new numbers today. So in Ohio, we are up to 79 cases now. To take that into account, in 2025, which was definitely an increase too, there was 45 cases for the entire year. So we're already up to 79. So we were just thinking of like, what can we do to hopefully stop spread in the community? We're thinking right now, there's none. But so what we're going to have is a walk-in clinic. And I should have put these at your desk, but I did not. So I'm just going to pass these down. But on September 15th, we are going to host a measles walk-in clinic to the public. We're going to be looking at vaccine records. We're encouraging everybody to bring them in so we can take a look at what they have and see if they qualify for it. It is not like a free clinic. We're not just saying we're doing free doses because we're not in an outbreak, thankfully. And so we don't have just free doses for everybody, but we we'll be looking at private insurance. We do have free vaccines for uninsured adults and Medicaid kiddos and uninsured kiddos. But we aren't going to turn anybody away for inability to pay for this clinic. That's just something that we'll just take a look at the cost on the back end, but it's more important that we get that coverage rate up. So I'm excited about it. I'm hoping that we have a big, what I'm trying to say, just a lot of people come in, but we'll see. This will be the first time we had a specific measles clinic, since I've been here. So I'm not sure what the turnout's going to be, but so yeah, if you have any questions about that.
You said we have no cases in Clark County?
No. For now, I know I didn't say that, but yeah.
Is, with the vaccine, it's been a minute. For people who cannot find their vaccine records or do not have them, are we offering titers or is there any harm in just going ahead and vaccinating?
Yeah, there is no harm. So per CDC, they said as an adult, if you can order a kiddo, if you cannot produce a shot record, that it's recommended that you could just go ahead and vaccinate. We weren't going to offer titers that day. It's not typically a service that we offer to the public, but there's also a caveat that if you're born before 1957, you're assumed immune. And the CDC does not recommend vaccinating. We work on standing orders, so we would not vaccinate that. But if there's a large population that come in, it's just like, well, I don't know if I had it or not. And they're just concerned there. And that's in high demand. We were probably going to offer maybe like a titer clinic for those people to come in and just to see their status.
Okay.
Okay. Thank you very much.
So the school nurses would know about this?
Yeah, so that one would send out to the commission, right, the superintendents. Yeah, it's going to go out to the superintendents to go down, because it's not necessarily meant for students. Like
Right.
staff, sure, but what we don't, it's not a back to school, right? This would be just like measles only or MMR only. So we don't want a ton of students coming, because that's not what we're doing in this clinic. Now, that being said, if we have the availability and a kindergartner comes, we're not just going to pop a measles and that's it. We would probably fully vaccinate. But at the end of the day, that's not the intent for this one. But for staff, yes, for sure.
Thank you, great discussion. Early childhood.
Yes, thank you. I included some pictures after my report of our summer event that we had. It was at our office, and it was a lot of fun. We had a lot of really low-cost activities for families, young families. And we had some donated raffle ticket things to raffle, like gift cards, and we had 103 there. So we were really, really crowded in there, but it was a lot of fun. So we'll definitely do that again next year. And the second thing I wanted to mention is that I'm delighted to introduce one of our Help Me Grow Home visitors that has been here 6 months. So this is Miss Linda Irwin. If she'd like to stand up and tell a little bit about herself, it'd be great.
Thank you for my job. I love my job. I did Healthy Families, Parents as Teachers in Indiana for 20 years. And I retired in January, and we just moved back to Springfield, where I was born and raised. And I heard about Help Me Grow, and I went in and asked Lori if there was any chance she would hire an old person for visiting. And she said yes. And I love it. I love the families and I like the way that she's got it set up for support of working together with the staff and stuff. So it's a really good program and I just wish we could get out and get more families and, get the word out. But thank you.
Well, to all three of you and you also on your promotion, welcome aboard.
Thank
Okay.
That's all I have this evening.
Okay. Women, infant, and children.
Thank you. Thank you. This month is Breastfeeding Awareness Month, or as we like to refer to it, BAM. To promote and celebrate BAM, the WIC team created a t-shirt to wear throughout the month, so I am displaying that tonight. We also held a breastfeeding resource fair, which included 12 community partners. As part of this month's report, I have those, that collage of pictures from our event. There are some really good ones, so definitely take a look. It was very well attended, our event. We had 62 moms, which was almost double from last year, and 99 additional guests, and that's tripling from last year. So we ended up with a total of 161 people during our 2-hour event. So I believe this is the best year for the turnout yet. Those who stopped by received breastfeeding support items, such as a bralette. We were able to obtain some bralettes from a wonderful company, Simple Wishes, where they were free. We just had to pay a minimum amount of shipping. So that was awesome. They also left with other breastfeeding support items, community resources, and a chance to win several raffle items. It was a great variety of raffle items from the community partners. So I just want to take this opportunity to give a special thanks to our nutrition and breastfeeding supervisor, Isabel Heising. She just took the lead on planning and helping to provide a flawless execution of our event this year. And additional praise goes to our WIC team for working together to share the information about our event with our participants, assisting in the preparation of the event and the setup, as well as our community partners, because we wouldn't have had as great of an event without their time during that day, sharing their valuable information, and also ESC, who provided additional interpreters for that day. So we were really tickled with the outcome.
It looks like a fun event.
Yeah.
Okay, health planning.
Yes, so you have the health planning update in your packet. I'd be happy to answer any questions. Just a couple of highlights. The first being, I think I mentioned it at the last meeting, but just a reminder that Overdose Awareness Day, our Overdose Awareness Day event is next Friday, August 28th from 3 to 6 at the National Road Common. So it's the green space in the middle of downtown. It's a chalk the walk again this year. And I believe there are 20 community resources that will be there, including treatment, recovery, all sorts of different providers. So if you have time and you're around downtown Friday between 3 and 6, stop by. And then just another thing to let you know, through our tobacco grant, that grant year just kicked off at the beginning of July for this grant cycle. And we are working towards, with the sheriff's office, to do compliance checks earlier in the grant year. So we usually do it towards the end, so it would be next spring, but we're gonna try to do them earlier this year. So you should be in the next couple of months, I should have some compliance check data for you through that. So
Thank you. Does Project Lead participate in this event?
Project Lead.
Mm-hmm. With McKinley Hall and Links Stage?
Oh, yes. I didn't know that was the actual name of it, but yes, McKinley Hall, Links, opioid grant, yes.
Okay.
Yes, they do.
Okay, legislative updates. Mr. Cook.
Well, the state legislature is still out. They're coming back for their first session on September 16th. So about a month away, a little less than a month away from them coming back in session. One of the things public health wise that we're looking at was House Bill 692, which was the sewage bill. We've been talking about this for months. That actually, just rewind, that passed the House with some amendments. Now it's going to the Senate. Probably be also some adjustments there, but you know, it had some things that were pretty damaging to environmental health and public health, and through some of those amendments, working with the legislature, we got some of the things changed. So we find it acceptable enough to support it, and roll with some of the changes that are going to be coming to the sewage program. One strange thing is we discovered in the amended House bill that was created, inside it was created what's called a sewage treatment system fund, and it's under the county commissioners, but there's no description or mechanism of funding the fund. It's very strange. It creates this fund. It doesn't say what you do with it, how money gets in, how money goes out, but it's under the county commissioners. We don't know about that one. So that may change in the Senate. So we'll watch that very carefully. Also in the realm of legislation and things like that, we know that with the expiration of TPS, temporary protected status, we've had some activity in our community, and just, you know, we've listened to some community leaders. You know, we're aware of things that are going on. When it comes to public health, we haven't seen any presence of ICE agents at any of our offices. I can tell you, just talking just casually with Lori, you know, some of our home visitors are seeing families leave, either by choice or not by choice. And so we're just being very, very cautious on how we approach, you know, anybody coming into our buildings. We have plans in place. We've exercised the plans. We've had meetings with all the staff to know what happens if ICE makes a presence in any of our locations. So I'm confident the things we put in place will be able to handle it in a professional nature. On a kind of associated with, you know, money and things like that, one of the things you'll see on your at your desk there, I think you said desk, yeah, it's a desk, is this. This is information about our levy. This is produced, you know, not on work time, things like that. Just some facts about it. Did anybody see the front page of the paper?
Yeah, it's a good article.
It was a very nice article. Jessica Roscoe did a fine job, as she always does for us. She sat down with Gracie and I last Friday in my office for about a half hour. Had a really good discussion about the levy and what it does. So it's going to be November before we know it, and so it's not too soon to start talking this up in your circles. So just would to look toward all of you to make sure you share a good word about the health department and this renewal levy coming up. And a couple other quick updates for you. Besides that, the rebranding efforts are still in full swing. We keep the staff apprised. I don't know when you drove in, did you see the top part of our electronic sign has now been changed out? It says Clark County Health Department as you drive out. Yep, the door when you came in now says Clark County Health Department. Business cards are in-house. We're getting ready to get those out to staff. So a lot of things are happening, and a few other things to be done at this building. This is the one that they started at, and then we'll move to High Street and Southern Village. So very exciting things happening there with our rebranding. And speaking of other things we've talked about in the past, actually for a couple of the board members, you may have no idea what I'm talking about when I say tiny home, or as we're calling it, Clinic Room 8. That's going to be actually out here. This was made possible through the Community Health Foundation and generous donation. Almost 100% funded by them is going to be, again, we're calling it Clinic Room 8. It's a tiny home that's going to be located on our property. Anytime we have, you know, a disease of interest that someone needs to be isolated for, if they can't isolate at home, we have to provide that housing for them and care for them. And it's always a scramble to find a place to rent or lease. And so, hey, let's have our own. And so this is the first one where we have room for another one if it becomes a good idea and it works out well and we get additional funding someplace. But Gracie and I actually just went up to Bell Fountain this morning and closed on it. So that was a fun thing to do. So we think in the next 60 to maybe 75 days, we'll have our home out here. So one of these board meetings, you're going to walk in and maybe it's going to be November. You're going to be like, hey, there's a home here now. And there will be. So it's very exciting. I know that The communicable disease staff is excited about it.
We're not calling it Clinic Room 8 though. It's Healthy House stuff.
The healthy house?
Yeah, we like that.
Okay.
Yeah.
All right.
Healthy Home?
It's been called a lot.
Yeah, that was good. I helped, yeah.
Healthy House.
Right.
We like Healthy House. Yeah, either way, you know.
Truly, the best thing about it is 98% of it is funded through the foundation, Community Health Foundation. So really appreciate them as always. That's all unless you have questions.
Okay, we do not have a reason for executive session. We don't have any other business, unless someone has something to add. Okay, so we are going to have our next regular meeting on September 17th at 6 p.m., the same location. Could I have a motion and a second to adjourn this meeting?
So moved.
Could I have a vote? All in favor, say aye. Aye. All opposed, same sign. Okay.
Thank you.